Hi, I'm Dr. Eric Schaefer from the Highlands Oncology Group in Fayetteville, Arkansas. And in this article, we discuss proactive treatment plans for the management of potential side effects in patients who are taking the kinase inhibitor ceritinib to treat their non-small cell lung cancer. Rearrangements or fusions of the gene for the protein anaplastic lymphoma kinase, or ALK, are one of the range of known genetic drivers of non-small cell lung cancers, and these mutations occur in 3 to 7% of all patients. Crizotinib is an ALK inhibitor that is approved in the U.S. for the first-line treatment of advanced ALK-positive non-small cell lung cancer. However, most patients acquire resistance within a year or two and suffer disease progression. Ceritinib is a once-daily oral ALK inhibitor with activity against crizotinib-resistant and crizotinib-naïve non-small cell lung cancer. Ceritinib was granted accelerated approval by the U.S. FDA in 2014 for treating patients who progress on or are intolerant to crizotinib. Patients taking ceritinib commonly experience gastrointestinal adverse reactions at the recommended ceritinib dose of 750 milligrams per day, and around 38% of all patients require a dose interruption or reduction as a result. Current recommendations for the management of gastrointestinal adverse reactions are reactive, that is, symptomatic treatment after a patient experiences a side effect. In this article, we describe a case series that detail our experiences with proactively treating patients for potential drug-related gastrointestinal adverse reactions on ceritinib. These patients were treated with ceritinib in clinical trials here at Highlands Oncology Group, and also with my co-author, Dr. Christina Baik at the University of Washington School of Medicine in Seattle. We implemented 2 proactive regimens, Regimens A and B, in 9 patients with metastatic ALK-positive non-small cell lung cancer treated with ceritinib. Regimen A used ondansetron and diphenoxylate, atropine, or loperamide taken 30 minutes prior to the ceritinib dose. Regimen B included dicyclomine taken with the first ceritinib dose, ondansetron taken 30 minutes prior to the ceritinib dose for 7 doses, and loperamide taken as needed with the onset of diarrhea. The proactive medications were tapered off depending on patient tolerability to ceritinib. We found that starting either one of these regimens before the first dose of ceritinib or as soon as any gastrointestinal symptoms were encountered prevented the need for dose reduction due to gastrointestinal toxicities in 8 of the 9 patients. Maintaining the prescribed dose is important for preserving efficacy. By using these regimens, 78% of patients were able to remain on a 750 milligram per day dose. 2 patients received 23 and 16 months of therapy and remain on ceritinib at 750 milligrams and 600 milligrams per day respectively. In conclusion, although these regimens are not currently recommended or implemented in clinical studies, based on the patients we have evaluated, upfront or proactive treatment plans such as these that address adverse reactions early on can allow the majority of patients to remain on the approved dose of ceritinib without the need for dose reductions or interruptions due to gastrointestinal adverse reactions. I hope you find this article informative and helpful in successfully treating your patients with ceritinib.